Thank you, Dr. Ishita. That was a comprehensive overview of the tricuspid valve. I am sure there's a lot of discussion will be generated on this particular topic because this forgotten valve has rolled back into our consciousness. And I think many of the participants will have questions. You can have your questions, but I think the time is limited. So we'll be entertaining only a few questions. Yes, anybody has a question? Dr. Sorangshu?
Okay, sometimes severe TR can be missed.
Yes, sir.
Because of laminar flow pattern, because of the small gradient between the RV and the elevated RA pressures, laminar flow can be seen.
Yes, sir.
Then how will you suspect there is significant tricuspid regurgitation?
So,
are there any clues?
Yes, sir. Thank you, sir. Yes, for that reason, there is the importance of visualizing the entire pathology of the RV. So visualize the RA size, RV size, IVC. It is very sensitive is the hepatic vein inflow reversal, which is a sensitive marker for the severe TR. Look for the vena contracta width if it's possible. These are the things which can't be missed. RA size, if you're getting as enlarged RA size, because in case of chronic RA, when chronic RA pressure is raised, you will get a less pressure gradient across the valve. So that we can, even impinging jet will decrease the mainly the volume size. So look for the hepatic vein flow reversal, which is very important. Look for the RV annular size, RA size, which is the RA volume assessment mainly, which is very important. And also look for the other pathologies. Because in these days, we are getting isolated TR, not only looking at the velocity or the gradient across the tricuspid valve is important. Look into all these things.
Do you have any other examples of systemic involvement of the tricuspid valve, systemic disease? You mentioned carcinoid.
Yes, sarcoidosis, in which sarcoidosis we can get infective endocarditis.
Also in Loeffler syndrome, hyperinsulinemia syndrome.
Yes, sir.
That the tricuspid valve is thickened with apical fibrosis and thrombosis.
Yes.
Thank you.
Thank you, sir.
I think we can conclude the session.
Yes. Thanks to all the participants. We conclude this session, and I think the organizers should take over now.
Thank you, sir.
Okay. Good.
Thank you.
Okay. Thank you, chairpersons, and thank you, speakers. Our next session is Symposium, Valves Revisited. The chairpersons are Dr. Dipankar Dotto, Dr. Aniruddha De, and Dr. Kajal Ganguly. And the speakers are Dr. K. Raghu, Dr. Arunno Sheel, and Dr. Shilanjan Roy. Chairpersons, please.
It's a great pleasure for me to introduce Dr. Raghu to you. Dr. K. Raghu is the Director of Non-Invasive Cardiology Lab of the Care Hospitals, Hyderabad. And he is the current President of the Indian Academy of Echocardiography. I wouldn't like to say anything more because if I continue, it will go on for a long time. I would request Dr. Raghu to take over, please, and present his papers.